Thank you, Mr. Chairman. Dr. Means, the Surgeon General is first and foremost the chief spokesperson for Americans' health. Wouldn't you agree? You would be the first MAHA Surgeon General. What is the public not hearing that you're uniquely qualified to communicate to them?
Well, first I would say that I think that for anyone who has not read the MAHA strategy that came out at the end of last year, it's a document that everyone should read because it outlines an unbelievably positive, comprehensive, forward-thinking way of addressing the root causes of why we're sick. It's a profound document. I think it's groundbreaking. And many of the pieces from that strategy document are already way out of the barn, and wins are happening already that are going to make healthcare and food more affordable and accessible for all Americans. And so I'm just very supportive of the work that's being done, and I do think it's a huge sea change shift from what we've heard from prior administrations in my lifetime. Or, at least since I became interested in the biomedical sciences, when I was 20 years ago, I have not heard at the federal level this sort of just impassioned, brave approach to talking about busting through, industry potentially conflicts in our research, the corporate capture of our agencies, and our health organizations, and just saying we're not going to stand for this anymore. We're going to put American health first, and not just in a reactive way, but in a proactive way. So all that is to say that I think we're going to see monumental progress over the next several years. And my deep hope is to be a unifying, practical messenger that brings people together around issues that I think every family cares about. There's not a person in this room who doesn't have a family member or a friend or know a child who's dealing with a chronic health issue. And we know that our environment is contributing to these, and we need to make it systemically and structurally easier for people to be healthy in this country. And that's what
When I read the MAHA strategy as articulated by President Trump and Secretary Kennedy, I mean, these aren't partisan themes or strategies. I mean, these are ideas that are broadly supported by the vast majority of Americans, right?
Yes.
Yeah. You've raised awareness about metabolic syndrome, how diabetes, stroke, heart disease, and their risk factors interact. What do people need to know about metabolic syndrome, and why isn't our healthcare system preventing these diseases?
Thank you for that question. This is one of my favorite topics in the world. So metabolic dysfunction and metabolic syndrome is referring to, not to get too technical here, but fundamentally it's the way our cells make energy and power themselves. We have trillions and trillions of cells in our body. They all need energy to work properly. Without that, we'd fall apart. Unfortunately, the vast majority of American adults now have metabolic dysfunction. By some studies, 93% of Americans adults have at least one biomarker of metabolic dysfunction, meaning there's this fundamental whole body cellular energy production problem that we know is deeply related to our diet and our lifestyles that then underlies diseases emerging all over the body, things like dementia, cancer, chronic liver disease, diabetes, obesity, heart failure, heart disease, stroke, et cetera. And so this is this systems biology approach that I'm talking about, that our healthcare system is not currently incentivized to look at the body as a whole system. We have over 100 medical and surgical subspecialties, and they are incentivized to look at one small part of their body. We need to bust that open, look at the body as a system, take the latest research on this unified sort of approach to health, and then start to transform clinical practice into that way. If we do that, we can help people earlier understand what's going on in their body and hopefully prevent some of these catastrophic diseases as people get older.
But
so
there's nothing partisan about that, right?
No.
Yeah, I didn't think so. Something else I don't think is partisan. You've been outspoken about the infertility crisis in America. More and more couples have trouble conceiving as so many women struggle to have healthy pregnancies. Why is that?
Yeah. So infertility is going up in our country, male and female infertility. It's going up about 1% per year. Up to 26% of women globally have a type of condition that can lead to infertility called polycystic ovarian syndrome. This is a disease I'm very passionate about because it actually goes hand in hand with metabolic dysfunction. There's certainly genetic aspects to it, but many lifestyle features as well. Right now, the current standard of care for PCOS is to prescribe medications for the metabolic dysfunction and for the hormonal imbalances. But what the research has actually showed us, good research, is that very targeted interventions on our diet, for instance, there's a particular study I'm thinking of that did a ketogenic Mediterranean diet, and in about 16 weeks, nearly all participants in the study reversed their PCOS markers just with a dietary intervention. That's one study. I'm not saying that should be the gold standard. However, this is not information we're hearing. It's not information we're giving to women in OBGYN's office, and I think that's really something we need to change. We need to give people empowering information about how to take their health.
Thank you. My time has expired.